ongoing discussion as to whether carotid stenting or surgical carotid endarterectomy is a better strategy has yet another added chapter. In the archives of neurology, researchers report on a meta-analysis of previously reported studies that indicates that carotid artery stenting appears to be associated with an increased risk of both short and long-term adverse outcomes when compared with surgical treatment. In the meta-analysis of 13 randomized clinical trials involving 7,500 patients, they assessed the risk of death, MI, and stroke within the peri-procedural period, as well as intermediate and long-term outcomes. In the first 30 days, carotid stenting was associated with a 65% increased risk of death or stroke and a 67% increased risk of any stroke. However, the stent procedure was associated with a 55% lower risk of myocardial infarction and 85% reduction in cranial nerve injury. Intermediate to long-term outcomes were assessed using a composite of death, any stroke, and ipsilateral stroke. Stenting was associated with a 19% increase in the risk of such an outcome and was also associated with a far greater increase in restenosis, as expected. The researchers concluded that carotid artery stenting has an increased risk of both peri-procedural and intermediate to long-term outcomes, but with a reduction in peri-procedural myocardial infarction and cranial nerve injury. So what is the take-home message from this report? First, both surgery and stenting are effective and have a low complication rate. Second, surgery is superior concerning some outcomes, and stenting seems to have advantages in others. In the final analysis, we still need to individualize therapeutic strategy for each of our patients, remembering to include aggressive medical therapy using lipid-lowering agents, antihypertensives, and antiplatelet therapy as well. I'm Peter Block with the CardioSource Heart Minute.